Hey everyone, welcome back to the channel. Today we're talking about something that doesn't get nearly enough attention: male infertility. Here's a fact that might surprise you. Male factors contribute to about 40 to 50% of all infertility cases. That's almost half. Yet, most of the conversation around fertility tends to focus only on women. So in this video, we're breaking down the real causes of male infertility, from low sperm count to hormonal imbalances, genetic issues, and more. Whether you're trying to conceive, supporting someone who is, or just curious about reproductive health, this one's for you. All right, let's dive in. What is male infertility? So first, what exactly is male infertility? It's defined as the inability to achieve pregnancy with a fertile female partner after 12 months of regular, unprotected intercourse. Unlike female infertility, which often involves ovulation or structural issues, male infertility usually comes down to three main things: sperm quantity, not enough sperm; sperm quality, sperm that are misshapen or damaged; and sperm function, sperm that can't move properly or fertilize an egg. Now, here's what makes it tricky. These causes often overlap. A guy might have low testosterone from stress, plus a genetic issue, or maybe an infection, and together, those make things much worse. It's like a chain reaction. One small problem triggers another, and suddenly, you're dealing with multiple fertility challenges at once. Low sperm count. Let's start with the most common cause: low sperm count, also called Oligozoospermia. According to the World Health Organization, that means fewer than 15 million sperm per milliliter of semen. Now, that might sound like a lot, but a healthy range can actually go up to over 200 million per milliliter. Here's how it's classified: mild, 10 to 15 million per milliliter; moderate, 5 to 10 million; severe, less than 5 million; and azoospermia, that's when there's no sperm at all. So, what causes low sperm count? First, hormonal issues. Your body has an incredible system called the HPG axis. That's the hypothalamus, pituitary, and gonads, and it's responsible for sperm production. If any part of that system is off balance, sperm production drops. Next, physical problems with the testes. The most common is a varicocele, which is basically varicose veins in the scrotum. They raise the temperature, increase oxidative stress, and damage sperm. Other causes include undescended testes during childhood, injury, or surgery. Then we've got lifestyle factors. Obesity throws your hormones off. More estrogen, less testosterone. Smoking damages DNA. Too much alcohol, recreational drugs, even constant laptop heat or saunas. They can all lower sperm count. And finally, medical conditions and medications. Things like mumps, sexually transmitted infections, diabetes, or certain cancer drugs can damage sperm-producing tissue. Poor sperm motility. But sperm count isn't the whole story. Even if you have millions of sperm, they still need to move properly. That's called sperm motility, or Asthenozoospermia. Think of sperm like tiny swimmers in a marathon. They need to swim through the cervix, up the uterus, and into the fallopian tubes. If they can't move efficiently, fertilization just won't happen. So why does motility drop? Sometimes it's structural problems. The sperm's tail or flagellum might be defective, which means it can't swim right. Other times, it's energy-related. Sperm rely on mitochondria, little power plants inside the cell, to fuel movement. If those aren't working, Sperm don't have the energy to swim. And then there's oxidative stress. Too many free radicals, often from smoking, alcohol, infections, or pollution, can damage sperm membranes and DNA. Here's the catch. You could have a completely normal sperm count but still be infertile if motility is poor. That's why a full semen analysis is so important. Hormonal imbalances. Now let's zoom in on hormones, because they control the whole system. Here's how it works. The hypothalamus releases GnRH. That tells the pituitary to release LH and FSH. LH triggers testosterone production. FSH helps sperm develop. If anything in that chain breaks, fertility suffers. Some common hormonal issues include hypogonadism, when testosterone levels are too low; hyperprolactinemia, when prolactin is too high, suppressing sperm production; thyroid disorders. Both overactive and underactive thyroids mess with sperm maturation; and metabolic conditions like obesity or diabetes, which throw hormone levels out of balance. And remember, these don't just reduce sperm count, they can also affect sperm motility and shape. It's all interconnected. Genetic and epigenetic factors. Now for the advanced stuff, genetics and epigenetics. Some men have chromosomal abnormalities that affect fertility. The most common is Klinefelter syndrome. That's when someone has an extra X chromosome, 47, XY, leading to testicular failure. Others may have Y chromosome microdeletions, tiny missing pieces of DNA essential for sperm production. Or CFTR gene mutations, which can cause the vas deferens, the tube that carries sperm, to be absent. And then there's epigenetics, how your environment changes the way your genes are expressed. Things like smoking, poor diet, or toxin exposure can alter DNA methylation and histone structure. And these changes can even affect the next generation. So yes, male infertility isn't just about the present. It can have long-term effects on offspring health. The takeaway? Male infertility is common, complex, and most importantly, nothing to be ashamed of. It's a medical condition, and in many cases, it's treatable. So if you're facing fertility challenges, get a full evaluation, hormones, semen analysis, lifestyle review, maybe even genetic testing. Understanding the full picture gives you the best chance of success. Thanks so much for watching. If you found this helpful, please give it a thumbs up and subscribe for more health science content. Drop your questions in the comments. I read every one. And check out the linked video below for the next step, treatment options and recovery. See you in the next one.